Good afternoon, ladies and gentlemen. We are the representatives of the Thames Valley Urgent and Emergency Care Network of 4 systems resilience, health and social care groups, patients and partners that make up this bid. I'm Annette Gamble, I'm a GP and I'm the Chief Clinical Officer of Chiltern CCG in Buckinghamshire. My colleagues are...
Hi, I'm Will Hancock, I'm Chief Executive of South Central Ambulance Service and I'm leading on mental health for ambulance services nationally.
Good afternoon, John Black. I'm an emergency physician from Oxford University Hospitals and also Medical Director for the South Central Ambulance Service.
Hello, I'm Cathy Winfield, Chief Officer for the Berkshire West CCGs and a former nurse.
Thames Valley comprises Berkshire, Buckinghamshire and Oxfordshire. We serve a population of 2.1 million people. The demographics of our population is very diverse, with a spectrum from the very affluent, including the Queen and the PM who are on our patch, to real pockets of deprivation in areas like Slough and Reading, where some disease prevalence is higher and life expectancy is lower than the English average. And everything in between on that spectrum, requiring universal provision for treatment and prevention, from newborn paediatrics to an ageing population and increasing numbers of people with long-term conditions with complex physical, mental health and social care needs. The diversity and complexity of our health and social care systems, our tangible progress towards new ways of working, capitalising on the Prime Minister's Challenge Fund, fast follower status from a previous Vanguard bid, acute provider reconfigurations in our system, and our proven track record of collaborative, capable leadership, innovation and improvement that performs well on urgent care national standards, makes our network ideal to be a vanguard, to accelerate innovation, share and learn best practice, whilst also presenting a blueprint which can be replicated nationally. Our proposed Thames Valley Urgent and Emergency Care Integration centres on a coordination centre, a single front door, using clinically supported telephony, interoperability of IT, the electronic glue, to share care records and connect individuals' needs to the most appropriate professional or services in their home, community, primary care or hospital when needed, not by default. South Central Ambulance Service already covers the footprint of the Thames Valley network, providing 999 and 111 services using NHS pathways and providing direct booking into out of hours and timely disposition. These services are pivotal to the success of our bid and development of the model, supporting further integration of local health, social care, voluntary services and consistent advice and support for individuals to manage their own health and well-being. Some examples of what we've already achieved: enhanced multidisciplinary primary care, extended hours, clinical pharmacists, proactive identification of frailty and anticipatory care planning, investment into best practice models such as ambulatory care pathways, psychiatric liaison, enhanced support for care homes, Better Care Fund initiatives delivering local single health and social care integrated hubs, SRG level standardised dashboard which provides data both on patient flows and support systems and flexing capacity, mobile enabled apps to support our population to use the right services, a medical interoperability gateway to connect the records of primary care providers, including into out of hours and A&E, specialist paramedics, GPs and nurses in urgent care, both to treat patients in their own home and support ambulance staff in the field. And this has enabled significant increase across all SRGs in both Hear and Treat and See and Treat. I'm going to hand over to Will now.
Thank you, Annette. I'm going to speak quite quickly. So Apologies for that, but just to give you a warning. So Thames Valley Health and Social Care System is absolutely full of people who are working extremely hard, doing their very best for patients. But very few of them at the moment are able to see the real-time bigger picture, which is so important to them. We are a high-performing area, as Annette said, but many of our patients and staff feel they're working in silos within silos within silos, leaving them making decisions without enough support and information. So our Vanguard is going to join up the dots. It's like a sat-nav system, if you like, for staff and for patients to help their way through it. Patients are increasingly accessing 111. Our plan is to make 111 the brand, not to invent other bits and pieces to fit around it, and to really try and push that. We've already at a very strong position with 111. We've got midwives, mental health nurses, doctors, other specialists directly available to patients and to staff in our contact centres. And as Annette said, we do book patients directly into GP appointments and refer directly into community teams as well. We do completely share the vision that NHS England have set out in the review, and we will set out to implement that vision, not some other vision. We think that the NHS for the 21st century needs to be more standardised, not a corner shop model. But what we will bring to the Vanguard is real scale. Yeah, so we've got we're one of the biggest NHS 111 providers in the country. We can scale up our model quite rapidly. This is a 2 million model, 2 million population, but we can scale up to 5 million very rapidly just within South Central Ambulance Service. And that system, because of the way it operates across the huge universal amount of different needs why patients access the ambulance service, can then be transferred across the rest of the country. Benefits for patients and staff, well, we're particularly focused on frail and the vulnerable, who often fall through the system and end up accessing services through police, through ambulance and through the emergency department. And none of those services at the moment really properly support people on their own. So working with the police, we've got street triage right across South Central, as you would have expected. We've got huge reductions in our Section 136 detentions for those in crisis, and nearly every patient now that is detained is now transported rapidly to a place of safety by the NHS, so treated as a patient and not a prisoner. We're also reducing frequent callers' reliance on the emergency services, ensuring the services they rely on are better joined up with personal information and care plans. So we've got a lot of work to do. We will focus on the brand of 111. There will be one door for patients, and we will build that confidence that they have in that one door. We'll share their information with us, but only once, and we'll have a workforce that's joined up and supporting one another behind the scenes.
Thank you very much. I need to stop you there. Sorry about that.
I appreciate that.
Thames Valley Network, thank you.